Hey ladies and gents, today we're talking about generic drugs and how much I hate them. Everybody says that generic drugs are equal to their brand name counterpart, and that if you have any adverse effects from generic medications, it's because of the binders and fillers. Yes, binders can have a very small effect on the pharmacokinetics of a drug, but not significant enough to alter a drug's metabolism so much that you feel like shit on one generic drug compared to another, or one's more effective than another if it's not psychoactive. So, number one, I would recommend reading the book Bottle of Lies. It's a fantastic book. It's a fantastic source of investigative journalism on the generic drug boom, and has so many first count witnesses of what happened back when the generic drug manufacturers started producing their generic counterparts of the brand name drugs, and how much horrendous shit went on behind the scenes, and the astounding lack of FDA oversight. The stuff I'm going to talk about today is egregious, but barely scratches the surface of what you can find in that book. Anything that I don't cite in the description below can be found in that book, and that's where I'm getting the information from. And the author has cited numerous resources and interviews and all sorts of stuff towards the end of the book. First of all, 40% of our generic medications come from India. India is a third world country where this is a Reddit post I made. India is a third world country where 157 million inhabitants practice open defecation. This means shitting in the streets, bushes, or water sources, anything but a fucking toilet. India's famous Ganga River is polluted by 3/4 of all the sewage generated in the northern plains, which remains completely untreated before being discharged into the Ganges and its tributaries. During festival season, over 70 million people bathe in the Ganges River to cleanse themselves of their past sins. More than 38 million liters of wastewater enter Indian rivers due to lack of sewage treatment plants and improper waste disposal mechanisms. India currently accounts for 17% of the world's scattered municipal waste. I believe they also account for the largest amount of plastics distributed into their nearest oceans. So not a good start, but let's go into the Indian manufacturing facilities, because we get 40% of our generic medications from India. I think almost all of my medications, unless they're specified to a pharmacy, like a specific brand that's made in the United States, has been from India. So, 11% of the generic drug manufacturing plants in India have been cited for violations, which is the most of any country in the world. And in this link, I quote, lack of written procedures for processes inside the plant, various quality control issues, insufficient lab records, poor sanitation and data security. In one of the most egregious cases of the year, FDA officials found discarded current good manufacturing practice documents and evidence of uncontrolled document shredding at Strides Pharma, an Indian manufacturer, in Bangalore, India. Of all the companies listed for repeat violations, nearly all were India. Meanwhile, while they are cited for major violations of current good manufacturing processes, you'll see that abbreviated as CGMP, these manufacturers are still allowed to continue their production of generic drugs while they come up with a report to right their wrongs, which is often denied by the FDA as being sufficient. These manufacturing facilities are not shut down during this period when they are cited or written a warning letter, despite continual potential hazard to patients taking their drugs. I would encourage you to just Google India FDA warning letter and glance at a few. It would be challenging not to be utterly repulsed by what goes on in these manufacturing facilities. So, 11% of their facilities have been cited. That's already bad. What's worse is that they get a 7-day heads up that an FDA inspector, is going to inspect their facility. This means that not only do plants who would otherwise be cited have the opportunity to make their facility look squeaky clean by the time an inspector shows up, but also that 11% attempted to do this but failed and were still issued a warning letter, almost always citing many violations of current good manufacturing practices. Many, not just one. Additionally, which is startling, there are 7,000 overseas manufacturing sites that have yet to be inspected by the FDA, which means there are 7,000 generic manufacturing sites overseas that haven't been inspected that are shipping their drugs to our pharmacy shelves. So they're FDA approved, but they actually have not been inspected for quality control, data manipulation, cross-contamination, anything that these manufacturing sites are commonly cited for. So you'll see, like I mentioned, if you Google India FDA warning letter, you'll see a plethora of them, and some of them are egregious. And so this is just one, and it's not even the worst one. This is the first result after Googling India FDA warning letter, and it's a letter cited against Intas, an Indian generic manufacturing facility. So here are a few key points of the citation. Quote, your firm's quality control unit failed to exercise its responsibility to ensure drug products manufactured are in compliance with current goods manufacturing practices and meet established specification for identity, strength, quality, and purity. Identity, strength, quality, and purity. So this means these drugs they do not have the strength, quality, and purity that they are purported to have by the manufacturer. Destroyed raw data paper printouts associated with drug products were discovered by our inspection team in a trash bag. This is not uncommon. I've read this several times in warning letters where they'll find raw data being actively shredded. And in one case in the book, it's mentioned that an FDA inspector was going through a facility, and a guy literally had a trash bag of data of their production, data going over their production, quality control, all that kind of stuff. And he saw the FDA inspector and literally sprinted the other direction. The instrument used for water content testing and assay testing is capable of storing electronic data. However, this capacity was not utilized, and you do not save this data electronically. Next, your firm failed to ensure the laboratory records included complete data derived from all tests necessary to ensure compliance with established specifications and standards. Your firm failed to establish and follow required laboratory control mechanisms. Additionally, your firm failed to establish adequate written procedures for production and process control designed to assure that the drug products you manufacture have the identity, strength, quality, and purity they purport or are represented to possess. And this goes directly against the idea that brand name drugs and their generics are equivalent, or one generic is equivalent to the other, because this firm is not reporting that they are producing drugs that have the same strength and quality and purity as other generics or their brand name counterpart. Additionally, your firm failed to establish the accuracy, sensitivity, specificity, and reproducibility of its test methods. In previous inspections, including the inspection in 2019 cited similar CGMP observations. You proposed specific remediation for these observations in your response. Repeated failures demonstrate that executive management oversight and control over the manufacture of drugs is inadequate. That's not even like the worst warning letter you'll find. And I have not seen one warning letter when it's just worse, sorry for my dog, that it's only been one problem, right? And oftentimes there's problems of quality control, such as strength and quality, cross-contamination between drugs, sometimes glass particulates in injectable formulations, and then microbial growth in areas that were supposed to be sterile but are not. You know, something so negligent as workers using gloves when handling sterile vials, for example, and then using the same gloved hands to push down the trash in a trash can, and then go back to working with these sterile vials that are no longer sterile because they just contaminated it. My experience with generic medications, this is my personal experience. While I was in the midst of encephalitis, I was prescribed clonazepam, which is a benzodiazepine. I was on Teva, which is a very reputable generic drug, and if I can, any generic medication that I require or need, I will try to get Teva because it's the highest quality generic drug I have ever tried for any psychoactive medication, including benzos, Adderall, etc. I was switched from Teva clonazepam when I had autoimmune encephalitis to Aurobindo, which is by far the worst, lowest quality, lowest potency generic Indian manufacturer for generic drugs I have ever experienced, and I suffered brutal withdrawals for a month. And people always blame it on binders and fillers. It literally felt like it had a quarter of the strength of the Teva clonazepam, and went through brutal withdrawals. I'm on testosterone replacement therapy, obviously. My testosterone levels varied by up to 110% from batch to batch of different testosterone cypionate manufacturers. And I was at a loss because I would believe that all medications were the same. I was like, why the hell am I varying so much? I have a friend recently who was 100 milligrams a test, measured his labs at the same time, had the same injection frequency, etc. And 100 milligrams he was 1,000 nanograms per deciliter. And then he switched to 200 milligrams per week, same injection frequency, same time getting the labs. And after 5 weeks, he was also at 1,000 nanograms per deciliter. So that's 100% difference in concentration. And with testosterone cypionate, there's no binders and fillers. It's just the ester. So you can only boil it down to the actual amount of active ingredient, the testosterone, in the oil itself. So the purported 200 milligrams per milliliter is not accurate. And you'll hear people say that the FDA allows a 20% variance in concentration with generic medications. Now, I've done some research on this, and as much as I want to back that up, I don't think that that's exactly accurate. However, I don't think it even matters because these manufacturers are just shitting out drugs that are way more or way less than their purported concentration of drug per milligram. After all that testosterone going up and down, and I couldn't handle it, I tried switching to a Pfizer brand name, and that was 4 years ago. And my levels have only fluctuated as much as 5%. So it went from 110% fluctuation possibility to 5% on brand name. And Pfizer was the first company to manufacture testosterone cypionate, so they hold the patent for the brand name testosterone, also known as depo-testosterone. Number 4, I've tried many generics of Adderall in the past and now. Some did nothing. Some made me feel crazy. Some gave me depression right away. And then finally, after switching to brand name Adderall, I had reduction in ADHD symptoms and had significantly increased executive function. Now, that was back in the day when I switched to brand name Adderall. I stopped for a long period, and only recently, after I've reached remission, I suppose, of my autoimmune encephalitis, I have found a generic manufacturer, Sunrise Pharma. Let's see where they're from, actually. They're located in New Jersey, so they're stateside. And it works just fine. So I'm not switching off that generic and paying the extra like $300 for the brand name right now. So, and then most recently I was switched from one generic of Lamictal to Aurobindo. And like I said, Aurobindo is ass as far as all generics go. They produce somebody said they produce poison. And they don't literally produce poison, but their concentration of their drug is so much lower than it's purported to be. So I'm on Lamictal for seizure control, and my doctor said it could help your mood, but primarily it was for seizure control because I had slowing my left temporal lobe on an overnight EEG. So I switched from Aurobindo to Lamictal, and I've been suffering from intense anxiety, agitation, and insomnia. Fucking done. It was only a few days ago I switched to the different brand of Lamictal, and I started losing my fucking marbles, and I was like, I am fucking done. I'm on 25 pills a day, Zyprexa, Lamictal, hydroxyzine, clonazepam, some others. And after that incident a couple days ago, I was like, I am fucking done. I'm done being yo-yoed around and suffering withdrawal that is not on my own time. So starting now, and starting 2 days ago, I cut my antipsychotic, not psychotic, I've been on it to stay stable while I'm getting into remission. But if I'm going to be yoinked around by these different generic medications, there's no fucking point in staying on them anymore. So I'm just going to start my taper. And it all sucks. Getting off this antipsychotic sucks balls. Getting off of benzos obviously is terrible. And I'm on high dose, 5 milligrams per day. That's going to be a rough ride. It's going to take a year at least to get off of. But I am done dealing with the bullshit of being switched from generic manufacturer to generic manufacturer and suffering withdrawals. You can find online very easily these warning letters describing cross-contamination, adulterants in their drugs, a lack of quality control, such as primarily the strength and quality that is purported to be associated with the drug that they're manufacturing. And so more commonly, I suffer withdrawals from switching from one drug to the other. And so whenever somebody says like their antidepressant or their Adderall or some psychoactive drug is usually the most noticeable, isn't working all of a sudden, I always suggest to take a look at the manufacturer and see if it's different than what you're used to. And if it's different, then that's probably your answer. If I want to withdraw from medications, I want it to be on my own time. So I'm going to start my taper off these medications now, and I have as of 2 days ago. Again, any information that I did not cite has been investigated and cited in this book, Bottle of Lies. If you do well on a generic manufacturer, I would try to stay on it if you can. If you don't notice a difference going from one to the other, great. You're just one of the people who aren't very sensitive to changes in concentration. I'm not one of those people. Every time I get switched from one generic manufacturer to another, I notice something. It's either better or it's worse. I never notice nothing. For the most part, I've never noticed nothing when switching from one to the other. And when I switched from the one brand of Lamictal to this US based to the Aurobindo, and I started having what appeared to be withdrawals from Lamictal, including brain zaps, which is common when you're coming off of an anticonvulsant, I was fed up. I was done. I threw my fucking pillow around the fucking room, and I was like, I'm fucking done. I'm so done with this. I want off all my medications. I don't care what it takes. I don't care how much I suffer. I want off all of them. On one hand, I don't want to fearmonger, but on the other hand, I want to spread what's the truth, right? And with 7,000 manufacturing facilities not being inspected that are putting medications on our shelves, not to mention these manufacturers that have cross-contamination, quality control issues, microbial contamination in what would otherwise should be sterile areas of the facility, et cetera, et cetera, et cetera. It makes me concerned and annoyed that the FDA constantly purports these medications as equivalent to the brand name counterpart, equivalent to other generics, and that there's no difference, blah, 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 blah. You're paying nothing, right? Your insurance covers for, let's say, Adderall, generic Adderall, and yet the brand name counterpart costs like $300 and something for like a regular month's worth of medication. And so when you're looking at different products online or food or anything, usually when you see such a high discrepancy, I mean, you can't even make a percentage of it because you pay nothing for one and then you pay $300 something for the other. It's like, which one's more likely to be of high quality, And yes, these brand name manufacturers have to do the discovery, the trials, etc., and they dump a lot of cash into it, so they have to make up for it somehow. But also, it's like you'll see. I saw a post on the pharmacy subreddit saying that they were getting pissed off that people want Teva Adderall because it's got higher street value. And I'm like, number one, that's probably not why they want it. But number two, why do you think it has higher street value? Just for some fucking random reason? No, because it's more effective. It's stronger. It's more dopaminergic. It actually fucking works. That's why it has higher street values, because it has higher quality. And so when you look at things like, I'm not saying you should get on Cycle. I'm not saying you should buy testosterone off the internet. Don't do it, all right? That's what I'm saying. But on Eroids, for example, they have ranked websites based on their quality and based on user experience and reviews that creates a free market for sourcing high quality, consistent anabolics. Whereas generic medications, there is no free market. You just get whatever you get, whatever the pharmacy is contracted with, who they're contracted with at the time. So there's no free market with your medications. And then, brand name medications are borderline impossible to get. I mean, Concerta brand name for a month is like $3,000 fucking dollars. In Canada, it's dirt cheap. I highly recommend that book, Bottle of Lies. There's so much in there that is like really fascinating and repulsive. And this just like touches, it's the tip of the iceberg as far as like how horrible shit has gone down. There are some manufacturers early on that did their data analysis on their medication, deemed that it had like 1% of the active ingredient, and then decided that they were just going to manipulate the data, present that to the FDA, and they shipped out the medication overseas to the United States. There are also doctors in Africa, and Africa just gets like the shittiest fucking drugs, because who gives a fuck about Africa, right? Doctors in Africa giving these children who are dying of infections medications that should bring them back to health, no problem, and they still fucking die. And the doctors are wondering why, and they discover it's because these medications are of such low quality, and literally people have died because of India's lack of control of their quality control and strength and cross-contamination and stuff like that of their generic manufactured drugs. I could go on about generic drugs for hours, but that's where I'm going to stop for today. Do your own research on that. And again, I highly recommend that book, Bottle of Lies, for more information on generic drugs. Let me know what you think and your experiences. Peace out. Somewhere unseen.